Hi, good afternoon. I'm Alvina Valentin. I'm the Communicable Disease Program Manager, and I'm going to briefly go over just a few revisions to our employee vaccination and TB screening policies. So just first of all, the rationale for this, in the policy, all Durham County employees for the Department of Public Health are considered healthcare workers in terms of this policy. And the whole reason that we were asked to take a look at it is, again, to ensure that all of our employees have protection against vaccine-preventable diseases in their line of work. And these are the two guidelines we looked at in revising our current policy. The Advisory Committee on Immunization Practices, their recommendations specifically for healthcare workers, and the most recent CDC guidelines in May of this year for TB testing and treatment of healthcare personnel. So the required vaccines are still the same for all employees of Department of Public Health: measles, mumps, and rubella, 2 doses; varicella, protection against chickenpox, 1 dose; and then Tdap, which is tetanus, diphtheria, acellular pertussis, 1 dose. In addition, employees who are at risk for exposure to blood and body fluids are also required to have 3 doses of hepatitis B. And then, as always, we recommend that all of our employees get their seasonal influenza vaccination. TB screenings, this is new. For new employees, in addition to your baseline tuberculosis test, these will be for new employees. You will also be asked to complete a baseline tuberculosis screening form. All existing employees, everybody in this room, you'll be required to have a baseline tuberculosis test on file since your date of hire. And then we have a group of employees who should know who they are, who are at higher risk for tuberculosis, who will be required to have an annual screening for tuberculosis. Okay, so for new employees moving forward, we're asking that the supervisors ensure that their new hires bring their vaccination records to the immunization clinic within 2 weeks of employment. We would actually prefer that they come like on their second day when they have that half day of orientation, if that's their schedule. The immunization clinic nurse at that point will review their vaccine records and schedule them for either titers to figure out if they've actually had the vaccine, if they don't have documentation, or vaccines, and the TB test as needed. Again, for new employees moving forward, once the titer results are available, which, as I said, if you don't have documentation for a vaccine, but you may have had it, that titer will let us know if you do have protection and whether or not you still need the vaccine. Then the immunization nurse will contact the employer and let them know if they need any additional vaccines, and then give them a new employee vaccination checklist and schedule them for these vaccines. When the employee has completed their vaccines and their testing, they'll send the supervisor an employee vaccination compliance certificate, which just says, like, yes or no, the employee is in compliance with the required vaccines. Doesn't have any medical information other than that. We're asking that the supervisors keep this certificate, this compliance certificate, in the employee file and ensure that employees who require annual TB testing, that they have that new certificate in their files each year. A good rule of thumb might be to do it at the performance appraisal time to make sure that any of your employees who are at higher risk for TB, who are required to have their annual screenings, that you've got their certificate in there annually. So the process for the existing employees right now, we're going to take a look at, well, we've taken a look at what we have on file, and the CD program nurses with some assistance from school health. We've reviewed all the employee vaccination and TB records that we have in Patagonia and NCIR and Laserfish. And we are in the process of preparing each employee an individualized note letting them know any missing documentation. So if you get a note, no panic. It doesn't mean that you necessarily need the vaccine. It's that we need the documentation, and then we'll let you know what you may still need. So we're going to give the supervisors sealed envelopes for each of the group of employees that they supervise with individual information. Then employees will have a week to bring us any of their missing documentation to the immunization clinic. Please bring us copies, don't bring us originals. After we review the missing documentation for every employee, we will schedule employees who are in need of either vaccines, TB testing, or titers, okay? After the titers are done, or the vaccines, or the TB testing, we will provide each employee with a checklist to let them know if anything is still missing, schedule them for those vaccines. And then when that process is done for our existing employees, we'll send the supervisors an employee vaccination compliance certificate for the existing employees. And then we're just asking the supervisors to follow the same process for existing employees. Make sure you have that compliance certificate as part of the employee file, and any employees that you have who require annual TB screenings, make sure you have a new certificate in their file every year, preferably at performance appraisal time. And just some acknowledgements. There's a lot of employees. I think we had 240 almost that we looked up records, and so just wanted to acknowledge the team that worked so hard on this. So thank you, and thank you also for collaboration from School Health.